Okay, so hello everybody. So the topic that we chose to bring awareness is depression in adolescents. Our group felt that it was really important, especially during the times during the pandemic, that to bring awareness to depression in adolescents, like teenagers, people, or students in high school, would be such an amazing topic to be able to spread awareness about and just give parents and teachers and students just a little more knowledge on this topic so that they can be able to see the warning signs, be able to understand where they can reach out for help, and understand that nobody's alone, even during the most difficult of times.
So, what is depression? Depression is something that people all over the world suffer from, which is a common and serious medical illness that negatively affects how you feel, the way you think, and how you act. It's the elevation or lowering of a person's mood, and it can cause persistently depressed mood, loss of interest in activities, and significant effects on everyday life. Depression can also be associated with thoughts of suicide. So, the history of depression in teenagers. The medical community once thought that depression only affected adults. However, the risk for the condition can begin in childhood or early teens. There are many factors that have increased risk of teen depression, some of them including negative self esteem, abusing alcohol, nicotine, or drugs, being gay, lesbian, bisexual, or transgender in an unsupportive environment, and witnessing violence. Suicide is the third leading cause of death for young people ages 15 to 24, and teens throughout history are depressed today more than ever. Every 100 minutes, a teen takes their own life, and only 30% of depressed teens are being treated. How many teenagers report having depression? About 20% of all teens experience depression before they reach adulthood. 1 in 5 teenage girls experience at least one major depressive episode, and 7% of teenage boys have at least one major depressive episode.
Now, with the serious topic of depression comes some sort of warning signs. So, with depression in adolescents, there are physical and emotional warning signs. An adult or a guidance counselor or a fellow friend can use these warning signs to be able to tell if their friend or loved one is in need of help. And with being able to use these signs would be very helpful. So, some physical warning signs could be tiredness, loss of energy, insomnia, losing or sleeping way too much. It could be changes in appetite, where it could be decreased appetite, excessive weight gain or weight loss, or craving food, and then the use of drugs or alcohol. Some examples of emotional warning signs could include feelings of sadness, which can include random crying spells for no apparent reason, the feelings of frustration, and the feelings of anger, which can be over only small matters, or the constant feeling of being hopeless or feeling empty. So, being able to spread awareness about these signs can be a lifesaver to your friends or family. Just you have to be able to see them when they're occurring. Now, how is depression diagnosed? When it comes down to diagnosing depression, there is no laboratory test to use to diagnose depression, but there are several tests that can be used to rule it out or rule it in. So there's two different tests that doctors can use in order to decide if a teenager is going through depression. So one test is the Zung scale. The Zung scale is a screening tool that is used to help assess the levels of depression in people who are depressed. It is about a 20-question test that provides a score from ranges to 20 to 80. Most depressed people score between a 50 and a 69. A score above that indicates a severe depression. Another test that students or teenagers can be able to take to be able to diagnose their depression is the Beck Depression Inventory. The Beck Depression Inventory, known as the BDI, is widely used to screen for depression and to measure behavioral manifestations and severity of depression. The BDI can be used for ages to 18 to 80. The inventory contains about 21 self-report items which individuals can complete using a multiple choice response format. So if a child or a teenager is feeling overwhelmed in feelings, maybe these feelings, or witnessing these type of emotional warning signs, physical warning signs, they could reach out to a doctor or a care group to be able to take these tests to just more gauge where they're feeling, to be able to link and connect these feelings towards maybe something like depression.
And then, do genetics play a role? Depression is known to run in families, which means that genetics contribute to the risk of developing this disease. Scientists have proven that having a parent or sibling who is diagnosed with depression are up to 3 times more likely to have the same problems. Up to 40% of people with depression can be traced back to a genetic link. And these are some of the risk factors. Genetics play a role. Risk factors means like things that can contribute to the upbringing of depression in an adolescent, which genetics, which I just talked about, conflict with personal problems or fights with family members, death or loss, abuse, or life events.
Okay, so these are going to be some statistics that our group gained on our knowledge about depression. So more than 264 million people suffer from depression worldwide, and women are twice as likely as men to have depression.
Adolescents aged 12 to 17 years old had the highest rate of major depressive episodes, followed by young adults 18 to 25 years old. And the rate of moderate to severe depression rose from 23.2% to 41.1% from 2007 to 2018.
Adolescents aged 12 to 17 had the lowest treatment rate of 41.4%, and of those diagnosed with depression, 1% of women and 7% of men commit suicide.
Okay, so this is prevention. So while depression obviously can't be completely prevented, there are some things that can help take some stresses off of teens, like getting enough sleep, eating well, exercising regularly, getting regular medical checkups, and reaching out to friends and family when times get hard or you're just feeling stressed out. Okay, so early intervention and seeing the signs early can help prevent progression of depression. So, some of those recognizing signs or triggers include loss of interest in everyday things, increased fatigue and sleeping problems, irritability, changes in appetite and weight, uncontrollable emotions, loss of energy, or feelings of hopelessness.
Now let's move on towards the treatment of depression. When you're depressed, it can feel like you can never get out of a dark shadow. However, even the most severe depression is treatable. So if your depression is keeping you from living a life that you want to, don't hesitate to seek help. Of course, there are no two people who are affected by depression in the exact same way. And neither is one size fits all for treatment to cure depression. What works for one person might not work for another. By becoming as informed as possible, though, you can find the right treatments that can help you overcome your depression, feel happy and hopeful again, and reclaim your life. The mainstay of treatment is usually medication, talk therapy, or the combination of both. Increasingly, research suggests that these treatments may normalize brain changes associated with depression. So, there are medications called antidepressants. Antidepressants work by balancing chemicals in your brain called nuclear transmitters that affect mood and your emotions. These depression medicines can help improve your mood, help you sleep better, and increase your appetite and concentration. Another way to be able to support yourself during depression is going to therapy or group therapy. Therapy or medical treatment is an attempted remediation of health problems, usually following a medical diagnosis. So in therapy, you can talk about some things that you're going through, release some stress, maybe rant to somebody who is willing to listen and is ready to help.
Mental health in children is just as important as their physical health. Good mental health allows kids to develop the right skills to deal with whatever life throws at them. If kids never learn how to properly regulate their emotions, they won't grow into a healthy adult with healthy coping habits. Depression is not Depression that is not treated can impact a child's education, communication skills, social skills, and much more.
Okay, so that was our presentation on depression in adolescents, and we hope we were able to spread awareness and teach more about this illness. So thank you for watching.